Hi, and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and I'm joined today by our Chief of Breast Imaging, Dr. Michelle Townsend Day. And in observance of Breast Cancer Awareness Month, we are going to be discussing ways to minimize your risk of breast cancer and important facts that you need to know. If you'd like to learn more, then stick around and give our broadcast a like. Ask your questions in the comments below. And we also encourage you to share this broadcast with your friends. Dr. Townsend Day, thank you for joining us. We appreciate you taking your time out of your day to be here. Could you begin by telling the viewers a little bit about yourself and the work you do here?
So I am the Chief of Breast Imaging here at MedStar Union Memorial Hospital, as well as chair of both departments. I spend my time in breast imaging, which is screening mammography, diagnostic mammography, and MRI.
Great, thank you. So let's get into the questions. First of all, who is at risk for breast cancer?
So the most common risk factors for breast cancer are being a woman and getting older. So those are non-modifiable risk factors. So there are additional risk factors which would include physical inactivity, hormone replacement therapy, as well as diet.
And are there any warning signs or symptoms for breast cancer for people to look out for?
If there is a change in if there's a change in your nipple, so if you have nipple discharge or your nipple turns inward or gets flattened and becomes inward, that's a sign of breast cancer. Enlargement of one of your breasts with pain and swelling is also a sign of breast cancer.
Okay. And why is it important to detect cancer early?
It's important to detect cancer early because the three pillars of breast cancer treatment, which includes surgery, medicine, and radiation, all can be less extensive the earlier that we find the cancer.
Okay. And what are the steps you can take to get the cancer detected?
So the most effective method for detecting breast cancer are screening mammograms. So early detection saves lives. So getting your annual screening mammogram beginning at the age of 40, if you're at average risk, is the best method to catch cancer if you do have it early.
And speaking of screening, what are the screening guidelines? Like the ages for starting and stop. Like, what are the guidelines for them?
So the guidelines for screening mammography are for average risk women to start screening mammography at the age of 40 and to continue annually until the age of 70. Well, not until the age of 74, as has been published in popular literature, but until the time that you are have greater than 10 years life expectancy, and as long as you're in good health. The newest recommendation also is to have a risk assessment beginning at the age of 30. So if you are at higher risk for breast cancer, you can undergo supplemental breast imaging.
And can you talk a little bit about the different types of mammograms?
As it relates to 2D versus 3D, or?
Yes, yeah.
So there are two primary types of mammograms. There are 2D mammograms and 3D mammograms, all of which are digital. The 3D mammograms are better for patients who have dense breasts. The majority, and about 46 to 48% of the population does have dense breasts. So 3D mammography would be quite effective. The 2D mammograms are also effective. However, the 3D mammograms do find more cancer.
Okay, great. Thank you. If you're just joining us, either watching it live now or on replay later, thank you for tuning in. We're speaking with our Chief of Breast Imaging, Dr. Townsend Day, and we're talking about how to minimize your risk of breast cancer. We have more to talk about, so keep watching, share this video with your friends, and give it a like, and please leave any questions you have in the comments below. So going on, what if you have dense breast tissue? Does that make it more difficult for detecting anything?
So dense breast tissue actually is an independent risk factor for breast cancer. And it does make it harder to detect breast cancer because of a masking effect. So essentially, breast cancers are white and your breast tissue is white. So if you have dense breasts, you have more white tissue, and it can possibly obscure your breast cancer.
Okay. And what if you don't have insurance?
If you don't have insurance, there is the BCC program, which is the Breast and Cervical Cancer Program. It's a nationwide program, and it provides access for underinsured and uninsured women to have access to screening mammography. It also enrolls those patients into Medicaid.
Okay. And what are the steps being taken now to ensure patients are safe coming in to get their screenings?
We are scheduling differently, so we're increasing the distance or time between patients that we have. We're increasing the size of our waiting room and decreasing the number of patients in our waiting room in order to decrease risk. We are doing a more comprehensive cleaning of our mammography and ultrasound suites prior to and before patients.
Okay, great. So can we go back a little bit to talking about the symptoms? You discussed them earlier, but can you go a little bit more in depth about them if people are just tuning in, or just kind of go over them again?
So for there are multiple signs that you could possibly have breast cancer. Doing a monthly self-exam would be one of the best practices you could start to do, so that you can feel and get to know your own breast for yourself, because you would know you better than your referring physician and or provider. So a lump that is fixed, that does not move, is concerning for possible breast cancer. Nipple flattening or nipple inversion, meaning that your nipple starts to go inward, that can also be a risk, a physical finding that would be concerning for breast cancer. Swelling, unilateral or swelling of just one breast with some warmth and redness are signs of a subtype of breast cancer that can be particularly aggressive, and that would necessitate that you go to your physician to get that evaluated.
And what age would you recommend people start doing this, like, getting their screenings or just kind of testing themselves regularly? I
think the sooner the better. So given the fact that the age group of people will be watching this, so I would say at least in your 30s to start to get to know your breasts and what they feel like. And again, getting a risk assessment by your primary care physician and or provider beginning at the age of 30, so that you know your risk. That will also empower you to make better decisions going forward with regard to screening mammography. If you're deemed to be average risk, I would recommend that you begin annual screening mammography beginning at the age of 40 to continue as long as you are in good health and are intending to seek or tolerate treatment, and as long as you have greater than a 10-year life expectancy.
Okay, thank you. And so what happens now if something is found? You go to your physician or doctor and they find, a lump, and what are the steps taken after that?
So if you go to your physician or provider and they find a lump, the next step is a diagnostic mammogram or ultrasound, depending on your age. So you come, we do the necessary imaging tests, and a radiologist will speak with you and tell you what the next best step would be.
And where can patients get a screening?
Within MedStar Health, we provide screening access points at MedStar Good Samaritan Hospital, MedStar Union Memorial Hospital, MedStar Harbor Hospital, and our outpatient imaging MedStar Radiology Network in Bel Air.
Okay, great, thank you. We received a comment from one of our viewers, or a question from one of our viewers. Amy asked, my mom had a number of benign tumors removed. Does that mean I'm at risk for breast cancer?
The breast cancer risk is attributed to actual breast cancer in first degree and second degree relatives, not benign tumors.
Okay. Is there anything else you would like to share with our viewers?
I think the overall emphasis for this month is breast cancer awareness, and the one thing that we can do as women is to get our annual screening mammogram beginning at the age of 40. For those young women who are younger than the age of 40, getting a risk assessment with your primary care physician and a provider would be useful, so that you know your own risk, and then you can govern yourself accordingly.
Okay, great. Well, thank you. That wraps up our broadcast. Thank you so much, Dr. Townsend Day, for joining us. And thank you to all our viewers for watching and sharing your questions. For more information about breast cancer screenings, available treatments, and more, check out the link in the comments below. We'll see you next time.